I am Colin. I am the course deviser and course leader for the MA in Arts Health at the University of Central Lancashire in Preston. Arts Health is the valid, ethical and purposeful use of the arts to enhance quality of life, either in health contexts or in relation to specific health conditions or specific health issues. Arts Health maximises care and well-being, teaches students all the research skills that they need, including funding, ethical approval, teaches students all the management skills they need, specifically strategic systems and operational levels of project management, which include managing people, kinesics, non-verbal communication and communication skills, networking, negotiation, budgeting, resourcing, everything to make a project successful. All the legal aspects of a course, so health and safety requirements, and data protection, confidentiality, these kinds of things. The techniques, methods and processes that make Arts Health effective, both in the broad and general sense, so there's lots of skills and knowledge that are developed in relationship to different art forms, different health contexts, health conditions and health issues, but also very specifically so that students develop very specific sets of techniques and strategies for making their own project interests effective. And all of the critical and reflective and evaluation skills that are necessary to be able to rigorously evaluate that work, and all of the articulation and presentation skills that are necessary to be able to disseminate that practice and move into effective and successful employment and continued sustainability of the practice. Students develop a breadth of knowledge and skills which enables them to use any art form. So this could be drama, music, creative writing, we've had jewellery making, ceramics, all sorts, in relationship to any health issue, health context or health condition. They also develop extremely specific, refined knowledge and skills that enable them to have a specialist area of practice. And this is quite diverse across the student cohort. So we have students who specialise in working with people with attention deficit hyperactivity disorder, using the arts to increase academic achievement. We have students who work with young offenders using forum theatre to help manage aggressive behaviour and so on. I could go on for a very long time about different examples of practice on the course. Perhaps one to point out that's commonly missed is students who predominantly work as artists, not necessarily undertaking community arts practice or participatory arts practice, very much working in a studio the way that an artist would, but using the arts very purposefully and ethically to raise public awareness and change public health in relationship to specific conditions or issues. So for example, the perception or conception of people with schizophrenia can be undertaken not only as an arts participation project, but also as an ordinary piece of artwork with exhibitions or concerts or performances that help to change the public health aspect of somebody with that condition and their quality of life. All of our students have gone into subject-specific employment with the exception of two who are employed but not specifically in Arts Health. Students have achieved careers as project managers, project facilitators, workshop leaders. One of the primary employers is the NHS. People also work in the private health sector and at hospices, obviously undertaking arts health praxis in all of these cases. People work with young offenders in probation services and rehabilitation centres. A number of our students have founded their own training and consultancy companies, which have been very successful. We also have students who work as freelance artists, working for national organisations such as Mind, which is a mental health charity that most people have heard of. Also accepting commissions from local councils and regional councils. A number of our students, approximately 45%, are already professionals practicing in the field. So we have psychiatrists, GPs, senior clinical therapists who nevertheless come and do arts health to supplement their careers and then take that practice back into their psychiatry or GP practice, and that's proved very successful as well.